So we ready for our first guests?
I think we are.
Okay, well, for those of our listeners who aren't aware, Perkins Will is one of the world's leading architecture and design firms. They have particular expertise in the realm of healthcare, building healthcare facilities. But that's just one of many. They also have expertise building, designing corporate interiors and corporate headquarter environments. And where those two things come together, it seems, is in this realm of active design. Active design, I think, is a term to describe the use of physical space to impact health and wellness. And our two guests today from Perkins Will are Amy Sickeler and Brenda Smith, who are both involved in design and healthcare at Perkins Will, and are about as close to experts as you can get these days in a field still evolving. So welcome.
Hi,
Brenda.
thank you.
And
nice to be here.
Let's maybe tell us a little bit more about Perkins Will and how your role as architect and designer has intersected the workplace wellness arena.
I think Perkins Will, I've been with the firm about 27 years, and it's always been at the forefront, wellness for the inhabitants of the buildings, but also from a broader scale, the community, and from a landscape. So all of these scenarios of design work together to create better communities, and then workplace is also so important. So it's always been at the forefront. And what I always tell folks is now we're being asked to prove that it's benefiting. So that's kind of this new realm that we're in, but it's always, architects and designers are brought up to better spaces, better the human condition. So it's always been a topic, and active design is just a wonderful outgrowth of all of these other initiatives that we've been working on.
So I'm not sure I did justice to this term active design, and I want to make sure our listeners know it's more than a buzzword. Can you define it a little bit more, maybe provide some examples of where, bring it to life?
Right, and as I said, it's more about the basics of community, so walking trails, biking trails connected to a building and to its inhabitants. And also we talk a lot about stand-up desks, but it's about active design tied to the human condition of activity with other people. So even in a healthcare arena where you have a nurse sitting for long hours, which is very stressful, is she looking outdoors? Can she stand up and talk quickly to a doctor to get an update? It's about active, not just sitting down for long amounts of time. It's about being active and tied to the space. We've done a project even with corporate America where we've cut through 4 floors and made sure, a lot of times consultants, and we learn a lot from corporate America. They move a little bit quicker than our healthcare arena, so that consultants are gone all week and they need to communicate with one another and see each other. So we do this stairs with conference rooms, and years ago we did that because we knew it was the right thing to do, but it was about getting people communicating to one another. But now we know the huge benefit of being active on those stairs, but if you don't have destinations, it doesn't work that great.
So
the other
stairs,
thing is, even with
stairs as conference rooms. So in other words,
well, if you put stairs, you could do stairs and have meeting areas and landings, so people quickly can have a quick stand-up meeting. But looking right through, you'd have sit-down areas. So conferencing and meeting doesn't mean you're just sitting. There's active. You might be walking on the stairs, but it's about its placement close to conference rooms. So that you're making the design tie to activity. And Brenda has an example for CHOA, Children's Healthcare.
So I was also going to say one of the things that enriches that in terms of our human behavior and making those sorts of choices appealing over the elevator are things like placing daylight at those staircases, views out that enrich the experience and motivate you. As an example of something that was done with CDC and Children's Healthcare of Atlanta, they partnered on 2 different initiatives. One was about using stairs, and they had a laser counter at the entrance and exit of all the stairs so they could could track the use of the staircases, and then they placed graphics on each of the landings with additional activity information. So it might be counting how many steps you had gone up at that point. It might be a station that would be almost like something you would see in a park for fitness stations with a chin-up bar, or a stretching activity you could do on that landing. And they selected their most major staircases. They had one staircase that was 7 stories that they used for this initiative. Data was collected with CDC, and they used that in terms of a study to determine, could you really motivate people to use the stairs.
Brenda,
the other thing that the hospital did is they turned it into somewhat of a competition among different staff department groups, so that they could track and incentivize them to be a part of it.
That makes a lot of sense. Brenda and Amy, this is Doug, and I want to thank you, as Andrew did, for joining us today. To what degree have some of the major, wellness program providers embraced this and are working with you around active design?
I think it's becoming more and more of a topic. A lot of times as designers, we do it and embed it like we did for sustainability and LEED. A lot of our healthcare providers didn't want LEED, but we did it anyway. Good materials, air quality. So right now with active design, it's becoming a topic, but with a lot of our wellness providers, it's not the first thing that they want to. It's just starting to happen, but we've embedded that in our projects for years and years and years. It is becoming a buzzword, and I think the thing with evidence-based design, that we're asked to prove it. With active design, we're being asked to prove that these things we put in place are a benefit, that it reduces stress, that it reduces insurance rates, that it reduces absenteeism. We know that it's the case, but we're being asked to prove it.
Well,
proving it.
Yeah.
Proving it requires that we have partnership with those clients to help gather that information once the space is occupied. So that's always the trickier thing to occur. We've started to put some initiatives in place in our contracts to measure results, both for ourselves and for the client's benefit. But that stuff is just getting off the ground. I would say in the last 6 months it's become a pretty serious conversation with our clients.
Right. I understand that you are, as they say, eating your own dog food in some ways. Your Atlanta office, I know, has been designed so that people are configured, or somehow you're making it so that people are taking the stairs more, and there are treadmill desks. But what I understand is that there's a stand-up desk study going on. Can you talk a little bit about that?
That's right. We have, our firm is based on research, and we have a leg and an arm that's called Area Research, and they're working with the Center of Active Design on a stand-up desk, and they'll be tracking and they'll be gathering data and tracking the results of some of the things we talked about, the lowering of blood pressure, energy levels, excitement about being at work, overall wellness, and just being, and it's a kind of a short study. So a lot of times these studies we need to do at a longer pace. This will be a good one to see just the results. We also have sensors within rooms that track, will there be collaboration at this desk, because that's a big thing about work environment betterment. So we'll be interested to see the results that we're getting out of this.
So how many stand-up desks do you have?
We have about 3 right now.
Mm-hmm. Gotcha.
They're placing, I believe they're placing 24 on one floor. It's actually the floor that our science and technology group sits on. And they're in the process of installing those. They asked people on that particular floor to raise their hand if they wanted a desk and wanted to be a part of the study. So that's how they...
Shouldn't they have asked them to stand up if they wanted? Oh, never mind.
That's exactly right.
They may have done that. I don't know.
Okay.
Amy and Brenda, if I'm a corporate wellness director listening to this program out there, how do you recommend that they learn more about active design?
I think looking at some of the bigger firms, and I did say I work a lot in healthcare, and sometimes our corporate America kind of gets into this arena a little bit quicker because they have quicker turnaround in their projects. And I think looking at the Center of Active Design, they are a wealth of knowledge as far as different case studies, and then looking at your colleagues, whether or not it's GE or Eli Lilly or some of these other ones, and seeing their results. They're tracking results and getting to know other groups like Kaiser Permanente and some of the things that they've put into place. And just being there on the forefront and having it be a topic, because we're all about trying to better the human condition. And also we need to think bigger than just the desk. It's important, but we need to think about the community and the cities that we live in. And looking at what we're doing in these cities, whether or not it's New York City or Atlanta and the Beltline and all these things that have been wonderful wellness introductions into our communities.
And the Belt, just so people know, the Beltline is I guess, reuse of a railroad track that loops around Atlanta, and Perkins Will has been really a prime driver in creating that, and it's really changing the city, not only socially, but I think from a health perspective as well.
Right.
And it is about the community. And I think you'd find a lot of corporate wellness directors leaning really forward to this message, this active design message, because they are looking at the connectivity with the community. They're looking at the total well-being of their population. And I would think that active design would play also a role in better retention with employees as well.
Absolutely, absolutely. And all the basics that we've learned from sustainable design or evidence-based design, that's all about doing things that are the right thing to do for people, views, daylight, air quality, and then tying that to the community with walking and biking paths and making it purposeful. And as I said earlier, it's about tying to a human condition and activity that makes it make sense. I was going to state, if you put a stand-up desk in a room in fluorescence with no views out, the results are not going to be great. It's about creating these spaces that are active and tying it to a program and a client need, and then doing a beautiful job in integrating to the landscape and the sky and functionality.
So, Amy and Brenda, if there are just a few takeaways that you'd like our audience of health, corporate health and benefit executives and health plan executives and others that serve that market, just a few things you'd like them to take away, what would those be from this conversation?
I think to have it as a priority of wellness and active design, a lot of times I talk about healthcare 30 years ago where maybe windows weren't even placed in a patient care. Now we know the benefit, and we instinctually know the benefit of active design, and having it as a priority, believing in it because inside you know it's the right thing to do. And don't get held up with budgets or constraints, and make sure that it's the top of your priority. Reaching out to the community and being a benefit to all is, I think, a priority that we want to hear all of our clients stating. And as I said, we do it no matter what, but a lot of times we don't have our clients, it's not on the tip of their tongue, and we want it to be.
And I think as they pursue projects or they think about the things that are in their own buildings, a lot of that is just tying program function to strategy. So you've got to have exit stairs. You've got to have glazing in your building. Is it really that much more difficult to plan as a priority to tie those things together? And then the other point I would make is because we've become such a data-driven society, the more that we can partner to measure those results and go beyond our intuition really helps. It helps not just those individual clients, but it really helps move the industry forward because there's takeaways that then their peers can tie to in terms of absenteeism and productivity and things like that. They really are measurable. It's not difficult to do. I think back to what we've done with lead design, where one of the things that you do as a post-occupancy is an easy survey where end users, occupiers of space, comment on their own personal comfort around lighting, temperature control, personal control of space. It could be something as easy as that gives you some results of what the occupiers of space, how they feel about it.
Right. Good. Well, thank you so much for joining us and sharing your experience and perspective on this.
Thank you.
I have a feeling our audience is going to want to learn more about you, about this topic. Can you just remind them of the best way to do that, to find out more about you and Perkins and Will and active design? Yeah.
You can find Perkins and Will easily on the web. It's perkinswill.com. And I think you can tie to Amy and I for contact information there as well.
And also area research, which is John Haymaker and many, many people here, which is it's a great group that we have here that does research with many organizations.
Mm-hmm. Well, great. Well, guys, thanks again, and we look forward to maybe catching up again sometime soon and hearing more results of
That'd be great.
Active design. Thanks so much.
Thank you so much.
Thank you very much.
Bye.
Take care.